Hello, my name is James Hunter, and this is my 2 cents channel where I talk about wellness related topics from physical fitness, mental health, and so on, and just topics that I find of interest. Today I'm going to talk about some of the more immediate benefits of exercise for people who have diabetes type 2. And I want to talk about, some different situations here. You have what are called acute adaptations, which is basically, the process, what occurs in your body during and shortly after exercise. They're pretty much immediate, or what's referred to as acute. So we're going to talk about this situation and also the long-term benefits of exercising for people who have diabetes type 2, non-insulin dependent type of diabetes situation. So we're going to look at both situations. With the more chronic and long-term adaptations of exercise, that's a result of repeated bouts of exercise over a longer period of time. So I put some notes up here on my board, kind of like just a reference point I'm going to talk about. Now, as a personal trainer, I will say that living in South Texas, I believe at one point we may still be #1 in the nation for diabetes and also obesity. So I've seen a lot of that when clients have come to me as far as, they have a goal of losing weight, trying to improve their health. And I'll also find that they're on medications for diabetes type 2 because they have uncontrolled blood sugar levels, between 200, 400, in that range. It's out of control. So we're going to talk about different situations here as far as people who are sedentary and overweight and versus people who start to become physically active, and how that's going to, in the short term, as far as the immediate benefits you're going to see, and then also the long term. So when we look at the different types of exercise, we have resistance training and also aerobic training or cardiovascular type training. We're going to look at both situations. Now, what I have noticed is that with individuals who come to me for help and who have had a goal of weight loss, when I do a food analysis of basically what is their nutrition, what you'll find are people in combination with being in jobs where they're sedentary, is that most of their food is coming at them through a window, fast food. Burger King, McDonald's, Wendy's, tacos, processed foods, a lot of sugar type beverages. And what you'll see with people who have this type of a behavior profile is that later in life, you have what's called late adult onset diabetes type 2. They didn't start off that way. They at one point in their life were significantly lighter. They may have been more physically active. I've seen this with people that I played sports with when I was younger in school, in high school and so on, or even in their 20s when they were more physically active. I'll see these individuals later in life when they're, early 40s and older. They're 30 to 40 pounds overweight. They have a job where they're sitting at a desk. So what happens is with these individuals is that they become desensitized to insulin. So insulin, which is a hormone, it's no longer able to do its job with the utilization and uptake of glucose. I'm going to talk more about that. So their blood sugars levels will start getting high. So in that situation, they're still producing insulin of diabetes type 2, but the body is no longer sensitive to it anymore. So let's talk about exercise. So when I work with individuals that I've worked with in personal training in my studio and in just other situations where I just may consult with them to discuss information and to get a plan, people by nature, and I don't want to use a broad brush because not everybody is the same, but you will find people, if they don't have a previous lifestyle or foundation, and then they find themselves later in life with a health crisis, diabetes type 2, they're overweight, they don't feel good, and they need to intervene. They have anxiety about that situation, and for some, hopefully most, they'll have a sense of urgency. They need to do something. So what happens is they want results now, right? You heard that before. Well, how soon before I see results? How soon am I going to be able to get this situation under control? The good news is that yes, there's some certain things you're going to experience more immediate. So you're going to start to feel better, #1. But let's talk about the acute adaptations of the first over here with aerobic training. I'll talk about strength training and weight training because it has its place. So let's talk real quick like with diabetes. I have to mention the pancreas. The pancreas is the endocrine gland that plays the largest role in metabolism because of the production and release of insulin and glucagon. Both of these are essential for the uptake and release of glucose, which is vital to the survival, or for the survival of the body. So remember, I talked about people of diabetes type 2 who are the non-insulin dependent types. They lose their sensitivity to insulin. They become desensitized to that. So the problem is that they're not going to be able to utilize the insulin, which is the hormone, and also glucogen. Both of those are essential to have the uptake of the glucose. So that's one situation that's going on with them. But here's the good news. A single bout of high-intensity aerobic exercise has been shown to increase the sensitivity of insulin and actually stimulates insulin-mediated glucose uptake in non-insulin dependent diabetes mellitus. So one single bout of exercise. Now, granted, you have situations with people that are trained, you can call them trained athletes, or trained with exercise, moderate to maybe higher levels of intensity. They've been doing this for a while. Now, I'm going to talk about that and more of the chronic, longer-term adaptations, where you're going to see an efficiency over the long term increase in this area with the utilization of energy substrates like carbs, fats, and so on, and how all that comes into play as you age and get older and so on. So let's look down here. A single bout of exercise has been shown to increase insulin-stimulated whole body glucose uptake for up to 48 hours. So after one bout of exercise for up to 42 hours, you're going to have improvement in this area. Your body essentially is becoming sensitive again to insulin, so you can do its job as far as getting that glucose uptake. So glucose uptake is increased after a single bout of exercise. So if you're somebody who's new, you're trying to make to exercise, you find yourself middle age, later in life, and you're in a situation where you need to start doing something. Well, rest assured that you're going to start to see things like I'm talking about right now as far as some improvement. You'll start feeling better. As far as the losing weight, that's a process, and that's going to be over a longer period of time. But I'm going to talk about a few clients that I've trained before. I'll mention one, and I've trained numerous ones of diabetes type 2. So I trained a female client. She was in her mid to late 40s, a nurse. This individual worked 2 jobs, worked at a hospital, and then did home health care. So this individual worked a lot of hours, was always on the go, and essentially was eating, her meals fast food. She was overweight, over 200 pounds, maybe about 5 feet. She was a tall, I guess tall for a lady, about 5'6", but over 5'6", almost 5'7", well over 200 pounds, probably about 225, 230 in that neighborhood. So and her blood sugars were on the upwards area of close to 400, and she was taking medication for that. So she did not start off this way. She developed this later in her life, in her 40s. So within the first month, within the first few weeks, the first week she was already feeling better, noticed an increase in energy. She would check her blood sugars with the glucometer, or you get the strips and so on. Those of you who have diabetes, you're familiar with that. So she would do her blood sugar before exercising with me during our one-on-one session. And then we would check it again afterwards. And, as expected, her blood sugar would be significantly lower. It'd be like well under 100, sometimes like, 78, 80. And this was after exercising, a combination of strength training and some, high-intensity aerobic type exercise situation. And I'm going to talk about the intensity here in a little bit. So with this lady, long story short, she lost probably 45, 50 pounds. She no longer had a situation where her blood sugars were out of control. In fact, when they did her A1C, which is a measure for diabetes, I believe 4.6 up to 6 is normal. And then when you get higher than that, you're getting into the an indication of how much blood sugars you have throughout your bloodstream and so on. So that measure she did of her doctor, it came down into the normal range within like 3 months. She was there. Her doctor was like, "Well, what are you doing?" Which should not be a big surprise, She changed the way she eat, and I can talk about nutrition in a different video, but She essentially changed the way she eats. She was, preparing her meals, clean whole foods and so on, caloric intake, estimated energy requirements. We can get into that whole discussion, but she did the things that were essential in terms of nutrition that was commensurate or what was representative of her goal to lose weight. She got into a calorie deficit or negative energy balance, if you will, to lose weight, and then only took in sufficient calories from an appropriate amount of macros and other essential nutrients to meet her health and energy needs, and no more than that. So change in lifestyle, exercise, change in the way she ate over a period of time, and consistency. That's what she did. It was not a surprise. So, I'm not trying to say that all doctors are prescription happy, because they're not, but sometimes in certain areas where you have high incidence of diabetes and so on, the expectation, if you will, for some people is that they're going to just keep prescribing and prescribing. Well, this individual, the doctor wanted to continue. Let's just keep prescribing the medication. So, and I'm not saying everybody's the same, because they're not. So this is what was best for her. So what she did is that after a period of time, she found that she was able to control and manage her situation without having to take medication anymore. Now, granted, this is a situation that it's not a permanent fix. She has to continue doing those things. She has to continue to exercise, continue to keep her weight within a healthy, her body composition within a healthy area, and keep her weight down, continue to exercise, and she can manage that situation. That was her. I'm not speaking for every individual case, because there's variability of different situations of people. But that's just one example of a lady who lost weight, changed the way she ate. The high intensity aerobic exercise or interval training, for those of you who are familiar with that, it got her blood sugars under control. And the reason we saw results rather quickly with her is because of these acute adaptations, with the high intensity showing that it has stimulates insulin-mediated glucose uptake. So you can see that in a relatively short period of time. You don't have to wait till I trained for a year and lost 40 pounds. You can see that happen in a relatively short, reasonable period of time. I hear accounts of people that I've trained. it's fairly consistent. I feel so much better already. It's been 1 or 2 weeks. They already feel better. So, this is something to think about in terms of how you approach, when you think about your health and fitness and what motivates you. Because we do need things that kind of reinforce us, that makes us feel like, hey, it's effective, it's a means to an end. And so when you kind of focus on what you're getting out of exercise from the short term, that can, help motivate you. And then, of course, you're going to have more chronic or long-term improvements. You can have an improved change in energy substrate utilization at the cellular level. So when you think of energy substrates, fats, carbs, heck, even protein if your body's in survival mode, but that's typically not the case. Your body will fuel shift from breaking down glycogen and fats, fuel shifting dependent on what your energy system, bioenergetic system, and the demand you're placing on the body. So when this talks over here about the high intensity, what comes to mind with me for people that are trying to lose weight, and especially of diabetes type 2, if you're trying to increase the sensitivity of your body to insulin, I think of EPOC. EPOC, those of you who are maybe familiar with that term, it's an excess post-oxygen consumption. Basically, it's a fancy way of saying the harder you breathe between sets, your body is more likely to fuel shift from back and forth from breaking down carbs to fats, glycogen and fats. So if you want to disturb and disrupt your metabolism, disturb it if you will, then yeah, you need to increase that intensity. You can do jump rope, squat jumps, sprints, anything that puts a demand on your body. It's going to get your heart rate up. You may have heard of Tabatas, which is it's an app you can get and download. It's fairly cheap, like $2. And Tabatas, basically you can pick, I usually do 8 sets of maybe 30-35 seconds with 8 seconds rest between each one. And I'll pick maybe a couple, maybe 3, sometimes just one exercise. And I'll do that as hard as I can for that 35 seconds, shortly rest, and then go again. it gets your heart rate up, you're breathing hard, and that's what you want. That's what you want in terms of, disturbing your metabolism and that high intensity. So with steady state cardio, yeah, that has its place too. For sedentary people, the suggestion still is, I believe, is around 20 to 30 minutes a day of moderate intensity. It could be a brisk walk. It can be what's appropriate for where you're at, and then you can gradually increase that over time. So you can do that if you're not fit, you don't have the fitness yet to do more high intensity related type exercises. But with progression over time, as your body makes neuromuscular adaptations, as you become more coordinated and better conditioned, then yeah, you can start adding more intensity into your workouts, and then it's like a snowball. It gets better and better because now you can have more quality workouts, and then the results become exponential. They become better over time. So long term, you're maintaining these benefits. So a lower body fat percentage decreases, fat-free mass is increased, and this ties into lifting weights. So I'm going to talk about resistance training. I'm going to hit on that. Your metabolic rate is increased. So you hear the term post-metabolic afterburn. You'll hear a lot of other slang terms that are used in the gym, or bro science and so on. But to put it simply, is that yeah, if you have a lifestyle of working out, at least 5 days a week like I do, and you have a combination of strength training, high intensity aerobic training, some form of stimulation of the heart and lungs, and just getting out there, moving and breathing, it doesn't have to be overly complicated. If you're doing that consistently over time, then you are going to have an improved metabolic rate because your body is becoming more efficient, and it's making adaptations to utilize energy substrates more efficiently through our energy pathways. The availability of our fuel substrates becomes more efficient as well. So the body, if you're sedentary, sitting on your butt all day, your waist is bigger than your hips. You've seen it, the beer belly type situation. Or it don't have to be beer, it can be just, all the foods you're eating in general. So that situation right there is just a recipe for you to be at a higher risk for diabetes type 2 and a number of other health problems. Not to go on a tangent, but we're going to stick on the topic of diabetes type 2. So as far as exercise is concerned, a general rule is that bouts of exercise that have a higher volume and shorter rest periods, they elicit a much stronger effect as far as the endocrine responses than bouts of exercises with lower volume and longer rest periods. So think about the gym. Let's talk about lifting weights. If you're supersetting dumbbell flies with dips, and let's say, you do maybe 6 or 8 reps, and then you take your time and walk to the dip station, and then you do 8 or 10 reps. And then after that, you rest, a good 8-10 minutes, talk to your buddies, get on your cell phone, and then you do, okay, I'm going to do another set. And let's say you repeat that 5 times. That's not much intensity, and it's really not going to be as challenging. So intensity is relative to rest periods between sets, because it just doesn't give you a chance to recover as fast, which is what you want, because that's how you increase your conditioning and for the body to make adaptations. Your body is going to adapt based on the stimulus you put upon it. So once it meets the demand of that current stimulus for that activity, it's sufficient to meet that demand. So you can do the sets the way I just described them. You are already sufficiently in shape to do that. So it's not as much stress on the body. So when you increase the intensity by lowering your rest, maybe adding some weight, and then actually you can add the volume that it's mentioned of up here, go 12, 15 reps. So when you do that, now you're increasing the demand on the body, shorter rest periods. Now the body's in a situation where it's got to adapt to meet that new demand, and that's what you want. So with the exercise component, though, as far as the higher intensity, that's just something to think about. Look at your rest situation between sets, and that could be a different video talking about volume versus heavier weight, lower reps. But then that gets into body composition goals. Whether you're doing bodybuilding, powerlifting, or power building, and an in between. But for this video, for the point, trying to be healthy. If you have diabetes type 2 and you're wondering about this situation here and what you can expect, this is some things to think about. So what are your thoughts on this situation for those of you, maybe you've had diabetes type 2 type symptoms that were out of control, and now you have it under control. It's being managed. Maybe you're not even on medication no more. So what worked for you? Was it something along these lines, and now, hindsight, you look back and you're like, yeah, that makes sense. That was me. Or maybe you're somebody who has diabetes type 2, and perhaps your exercise program and your nutrition, maybe for some reason, you don't feel that you're getting the response that you would hope to get your situation under control. Maybe you're not losing weight. Maybe you don't feel some of what I talked about. So what have you been doing? What works for you? So that's something you might want to look at. I think the intensity, the breathing aspect of it is real important. With resistance training, you're going to have a glycogen concentration decreases. So, that's something, to think about. You're breaking down glycogen. That's going to help. The aerobic type stimulation, you're going to break down. You can break down glycogen as well. You're fuel shifting, but primarily with weightlifting, it's anaerobic. You don't need oxygen to metabolize carbs or glycogen, so you're going to see that being used first. Testosterone, growth hormone concentrations, that increases with weight training, and that's going to help you with your body composition goals. And so with losing weight, building muscle, so that's going to be a supportive measure to your end of losing weight and managing your diabetes type 2. Exercise results in increases of epinephrine, which is a neurotransmitter, which also increases fat and carbohydrate breakdown. So you're going to see that from lifting weights, which is another more immediate positive benefit. And so you got a lot of things up here that I gave as examples. Do some of your own research. This video could go on for a long time. So if you want to put value into your health, you value that situation, then do your part. Do some research on it. There's different areas or sources you can look to. There's the National Strength and Conditioning Association has their research journals that have all types of studies and publications on a whole lot of different topics. You can look at different what medical websites. I'm not going to start name dropping. I'm not trying to give plug any or endorse any particular resource, but they're out there. So look it up for yourself. As they say, you can trust but verify. So until I make another video, I hope this is helpful. If this information is something that maybe is related to your situation, I'd really like to hear from you down below. Please subscribe to my channel. I appreciate the support, and I'm going to continue to make videos every week ranging on different topics, just like I said at the beginning of this video. Maybe physical fitness, mental health, and just things that I find of interest that technically you can tie into our wellness if it has an impact on either the mental health aspect or the physical aspect. So until I make another video, maybe tomorrow or later in the middle of the week, I hope you all have a good holiday weekend and take care of yourself. And all this information aside that's what it is. It's information. So knowledge, they say it's power, but it's not. It's the application of knowledge that is powerful and that can change your life. So once you gain knowledge, you have a responsibility then to apply that knowledge and make it become real in your life. So if this is something that gets you motivated to do more research and learn a lot more beyond than what I just said, because there's a lot more you can look up and learn beyond just this brief amount of information I shared, then go do that, because your health is worth it, and health is the first wealth. Take care.